Good morning, good afternoon, good evening. Whoever is seeing this video, we'll be discussing about the middle ear anatomy in detail. So if you take middle ear, I think everyone would have explained to you guys that it's a box, a closed room with 6 walls. Okay, so that's what we'll be discussing. Middle ear has a middle ear cleft. In middle ear cleft, we have the eustachian tube anteriorly, that is, it comes in the anteroinferior part, and then the middle ear cavity, which will be dealt in detail. The attic, that is something in the superior part, and the additus and the mastoid antrum. Even more posteriorly, we have the mastoid air cells. Coming to the pictorial representation of the middle ear cavity, so you can see, follow the arrow mark. So here we have a superior wall, that is the tegmen tympani, which is a thin plate of bone that separates it from the middle cranial fossa, and we have a tympanic membrane laterally all around, and just anteriorly we have the eustachian tube. There we can see a tube passing around, and anteroinferiorly you can see the carotid artery along with the sympathetic plexus. Okay, and we can also see in internal jugular vein forming the floor, which is on the inferior part, and just posterior-inferiorly you can see the facial nerve exiting, and you can see the whole part, that is the mastoid. The encircled part was the mastoid antrum, and from just posterior-inferiorly you'll have the chorda tympani nerve, above which will be a pyramidal eminence, and just above that will be the second genu of the facial nerve posteriorly. And coming to the medial wall, we have the superiorly we have a eminence of the lateral semicircular canal, the horizontal part of the facial nerve. Below is the oval window, along which, and below is a round window, and you can see a large eminence, that is the promontory on the medial wall, okay, along with the nerve plexus around the medial wall of the promontory, which is the basal turn of cochlea. Coming to the theoretical aspect, as I've told you, here we have the roof, which is formed by thin plate of tegmen tympani, which is part of the petrosquamous bone. Incomplete ossification can lead to infection spread to the middle cranial fossa. The floor is formed by the jugular fossa, which lodges the superior bulb of the internal jugular vein. The lateral wall is formed by the tympanic membrane. Superiorly, you can see a small bone known as the scutum, which usually gets eroded in your atticoantral type of diseases, the unsafe type of diseases. And inferiorly, tympanic is separated by the temporomandibular joint. Coming to the anterior wall, the anterior wall is much more narrower than the picture, so it just lodges the internal carotid artery along with some sympathetic plexus, and it also has 2 openings in the upper part, which we saw already, that is the muscle to the tensor tympani, and also the opening of the eustachian tube. There are 2 other small openings. In the upper part, we have something called the canal of Hager, which transmit the chorda tympani, and in the lower part we have a small fissure known as the Blazarian fissure, which transmit the tympanic artery and the anterior ligament of the malleus. Coming to the medial wall, we have a large eminence on the medial wall, that is the promontory, which will be the overlying basal turn of cochlea, and just above the promontory we have the horizontal part of the facial nerve running from anteroposterior in the fallopian canal. There is another projection in the anterior part which marks the start of horizontal portion of the facial nerve, and also there are 2 other bony ridges called the ponticulus and the subiculum. Groove above the ponticulus is oval window region, which is closed by footplate of the stapes. Groove below it is a round window, which is sealed by secondary tympanic membrane. The area between the ponticulus and the subiculum is called sinus tympani, where some inadvertent cholesteatoma can be left and it can recur, and bounded laterally by the facial nerve and medially by the medial wall of the tympanum. Coming to the facial recess boundaries. So facial recess is a small MCQ where it's laterally bounded by the superior part of the tympanic annulus, and superiorly formed by the short process of incus, and medially by the vertical portion of the facial nerve. This is reached in the posterior tympanotomy procedure in cochlear implant and tympanoplasties. The posterior wall, we have superiorly the adytus antrum, which leads from epitympanum to the mastoid antrum. Okay, and inferior to the adytus, we have a small projection known as the pyramid, which gives the tendon to the stapedius and also inserts to the neck of stapes. And below we have a pyramid, lateral to which is the opening of the chorda tympani nerve. Coming to the divisions of the middle ear cavity, we have the epitympanum. In the epitympanum, we have a small space known as the prosaic space, laterally bound by the pars flaccida, medially by the head and neck of malleus, anteroinferiorly by the malleolar ligament lateral, and post-inferiorly by the anteroposterior malleolar fold. This is the site for the formation of primary acquired cholesteatoma. We have the mesotympanum, which is medial to the pars tensa, the major air-filled space. It also contains the long process of the mucosal incus and stapes and mucosal fold. Next, we have the hypotympanum, part lying below the lower margin of the tympanic membrane, which contains the body and major portions of jugular bulb, and floor may be deficient sometimes, thus jugular bulb may be projected into the tympanic cavity. The protympanum, or the portion of the middle ear cavity around the tympanic orifice of the eustachian tube. Now coming to the contents of the middle ear cavity, we have the malleus incus and stapes, the bones. There are two muscles, that is the tensor tympani and the stapedius muscle. You have two nerves, that is the chorda tympani along with the tympanic plexus. Coming to the mastoid process and air cells, we have three types of aeration, that is called the cellular, scleroic and the diploic. So here we have the pictorial representation of the ossicles along with the middle ear cavity, that is the epitympanum, the mesotympanum and the hypotympanum. So here we can see the ossicles and its parts and tympanic membrane along. There is the malleus, the incus and the stapes. The malleus has an anterior process along with the head and handle of malleus, which is lying on the tympanic membrane. Here also we can see the second incus, that is with the body, short process and the long process. The long process is getting attached to the stapes, head and the foot plate, and also you have the anterior and the posterior crura, which is lying on the oval window, behind which you can behind and below you can see the round window. Coming to the mastoid antrum, it is one of the biggest and largest air cell, which is 4 x 4 mm in thickness and size. So it's anteriorly lied by the tympanic cavity, posteriorly by the other air cells. Medial is formed by the temporal bone, laterally by the squamous part of the temporal bone. Roof is by the tegmen antrae, and floor is by the mastoid portion. So one clinical significance is that we have McEwen's triangle, which is formed superiorly by the suprameatal crest or the temporal line going backwards, and anteriorly by the posterior margin of the external auditory canal, and the tangents joining these two. Other than mastoids, we have various others mastoid air cells, which is in and around those specific organ of the temporal bone. You can see around the labyrinth we have the perilabyrinth cells, around the tegmen we have tegmen cells, around the zygoma we have the zygomatic cells, around the petrous we have the petrous cells. So these are the named cells.